So carry on. What's your next step once you've got the loop?
Okay. Next step, we have decided to use a conar device, 8 by 6 or 7 by 9. We'll decide after discussion. But in both situations, if both device, we have to advance first the 6 French sheath from the femoral venous side, and we are going to try to advance it right now.
Okay. And obviously, I think you mentioned it, but when you're doing that, you want to make sure that the curve of the circuit, especially in the right
Yes.
ventricle tricuspid valve, is all nice and smooth.
Yeah, exactly.
Well, may I ask you, by using the corner M4, the possibility of attaching the wire on both sides, it's quite possible. So would you consider to implant this device directly from the retrograde, so you could avoid heavy loop, the circuit, the tricuspid issue, and probably it's quicker and safer to my experience.
Yes, exactly. I do agree with you, Mario. In case of no aneurysm, actually I prefer to use the arterial side, my personal preference. But in patients like this patient, we have to engage the device inside of the aneurysm, and it's easier to pull back the device instead of the pushing from the arterial side. But it could have done. Maybe, probably, I don't know. We will have to come from the arterial side as well, because if we will not be able to cross from the femoral venous side, we will be able to come from the arterial side. You're right. But my personal preference, instead of the pushing the device from arterial side to engage the defect, pulling back from the femoral venous side.
Just for discussion's sake, what other devices you think you could have used for this type of VSD? And from my point of view, would also work.
Okay. We could have used also ADO1 device, PFM coil, and LifeTech eccentric device, AVP2, maybe ADO2.
Yeah.
So that sounds like pretty much all the devices.
Yes.
One missed, which is
PFM coil, yes.
Available.
Okay. And any questions from the audience at all? Please feel. If there should be a microphone somewhere. Oh, there's one here, Hal. Oh, there's one there.
I don't like this curve, you know. I don't like this one.
How do you decide if you're going retrograde or antegrade to closing the VSD? How do you decide if you're going retrograde?
So the question, Enda, is how do you decide whether to go retrograde or antegrade?
You can use both sides of the device from retrograde and antegrade. Actually, my personal preference is to keep the safer the femoral arterial side. So doing a loop is much more safer to use the femoral artery. If the patient size is enough, you can use the larger sheath from the arterial side. This is one point. The second point, as I tried to explain earlier, if the patient has no ventricular septal aneurysm and the enough rim beneath of the aorta, you can come easily from the retrograde, from the arterial side, not doing the IV loop. I would like to remind you that you have only limited chance to make control angiogram when you come from the arterial side. You can do that, but it's limited.
Yeah.
You can easily control your position, and you can arrange your position if you come from femoral venous side.
Okay.
If you want to keep your device away from the aorta, I try to come from the femoral venous side.
Okay. I'm going to ask Mario because he has a slightly different view about this. So Mario.
Well, I think that by using the retrograde approach, probably you have better control of the tricuspid valve. I mean, you can deploy the disc on the right ventricular side and to be sure that you're not being entangled into the tricuspid. So that's my impression. You can do it both way, but probably it's easier from the retrograde. That's going to be
So
my
this,
favorite in most instances.
Mario, you've seen the
Yeah.
angiogram here.
Yes.
This is a 4-year-old, 18-kilogram child.
Yeah.
So still go retrograde arterial. 6 French sheath is what they're.
Well, I think 6 French in 18-kilo baby is quite safe.
Yeah.
Actually.
For
Okay.
me, it's actually,
Thank you.
it's a preference issue. Like I found interventionalists, they try almost only retrograde. And in our center, we mostly do retrograde. Only when we have difficulties, we do the whole loop.
Okay. So at the moment, you've got this is a
Yeah.
6 French sheath from LifeTech, or is it
Yes.
a Mullins?
It's LifeTech sheath, 6 French LifeTech sheath. I'm trying to cross throughout the VSD, but because we crossed from the smaller one, it's going to be a little bit difficult
Yeah.
to cross it.
Well, maybe that the wire and the loop is across a small hole
Yes, yes.
instead of the larger
Yeah.
one. That could explain the
Yeah.
difficulty in advancing.
Yeah, yeah, exactly.
Durandar, once you cross, do you prefer to keep your sheath in the apex or up in the aorta for deployment?
Sorry, I didn't understand.
Where do you prefer to put your sheath after crossing, in the aorta or in the LV?
Okay. It's always easier to cross to the ascending aorta, and we don't need to get to the LV, my opinion. I do always like that, you know. But the problem is the smaller defect is not allowing the cross from the venous side, the large sheath.
Yeah. And the guide wire at the moment is the Terumo, isn't it? It's not a stiff.
Yes, Terumo,
Yeah.
Terumo. But I preference is definitely Terumo because if it cross, it cross. I don't want to push with a stiffer wire.
Yeah.
So this sheath has
I'm
an
trying to
angle
slip
or
the-
the sheath?
Sheath?
It's a flexor sheath or angle?
This
or
is a
No, no, no.
LifeTech sheath.
LifeTech sheath. Okay. It's not crossing actually. So what can we do at that moment? We can come from the arterial side instead of the coming venous side. We can change the direction
Or
of the
do you,
sheath.
do you have any information from transesophageal echo about
Yeah.
the way where the catheter or the wire passed through?
Yeah. Maybe we can do another thing.
'Cause now your options are either to switch over to retrograde arterial approach or recross
Yes.
the VSD, break
Yes.
the circuit and recross the VSD.
Yeah, yeah. I guess we'll do. Okay.
Is it possible to have a look at the echo?
Yeah.
Echo, please.
Echo, please.
Echo.
So can you remove the color and just let us see the
Remove the color, Amira.
the 2D, just 2D, and
But I think when you have an aneurysm,
do a long
even by
axis maybe.
echo, we even with high resolution echo or whatever, I think it's going to be a bit difficult to be 100% sure what hole you crossed actually.
but we can see the sheath crossing. Can we see the
Yes.
long axis view instead of the
Long axis
five
view.
chamber?
Long axis. There is an angle actually and I don't like it. Can you?
Yeah, on the guide wire circuit, when you were pushing the sheath, there was still, it wasn't a
Yes,
smooth
there's an angle.
curve.
Yeah, it's not a smooth curve.
And I think the problem now is on the TOE, it's very difficult, as Mario said, to be sure whether you're through a bigger hole or a smaller hole with your guide
Yeah,
wire
we
circuit.
crossed
and the sheath.
definitely from smaller hole.
Yeah.
Actually, we intended to cross from smaller hole. I wanted to cross from smaller hole because the end of the day, the position of this device will be better if I crossed from the smaller hole, but it's difficult to cross from this side. We can change the sheath from arterial side. I will try it.
Yeah.
Just a minute. No, it's very...
Yeah, but
Just
if
a
the
minute.
problem with advancing the sheet is the size of the hole, it's going to be difficult
Yeah.
from the retrograde as
Yeah.
well. I mean, I cannot see the difference.
The curve is, the curve of the
Yeah.
sheath and the circuit
Yeah,
is just
I
not
crossed.
smooth.
You cross?
I guess. And this,
Yeah, but having a circuit, you just pull and you can pull everything across it.
okay.
It's going to be even more difficult to advance.
Okay, what will we do right now? We'll cross from the... okay, now I will break down the circuit and do it again.
ما هو ناحيتين زي بعض ينفع كده وكده.
Yeah, use the microphone if you could. There's a... Who's got the microphone?
Mario, come here.
Just a minute. It's difficult.
We need some...
Anyway.
Thank you. My question that how to be sure that we are not crossing the wire through the cordia of the tricuspid valve.
I will do it.
Sorry, say again. You
It's, if the wire is passing through the cordia of the tricuspid valve,
Well,
there
that's
will be some
obviously,
difficulty.
So that's one of the key questions to, when you have this sort of a curve, that's one of the key questions to reassess. So it's important then to break the circuit and then start again. There was another question.
Just put a regular
Yeah.
sheath here.
Yeah.
I need to put a shorter sheath.
Good morning, everybody. Good morning, Dr. Ender. I'm Ragda Sheikh with you. My question is,
Morning.
which is better to you, recrossing from the bigger hole or to retrograde approach? I guess this step, recrossing from the bigger hole is better. But I ask about your
Everything's okay?
opinion.
Yeah. Okay, Enda, do you want to answer that? Whether you'd think about crossing
Yeah,
from a bigger hole or
Yeah,
a smaller?
I'm crossing again. I'm crossing again. I'm trying to cross again.
Yeah, but bigger, or what will be your plan, or whichever one it crosses?
Oh, yeah. Bigger one, of course.
Yeah. Also, I noticed there was a little kink in that wire. I don't know if you plan to change it.
Yeah, I will. We can change it.
Wire remoting.
Yes, because when you snare it once, sometimes it just gets bends at the point where you're snaring it, so it gets this funny kink,
Maybe.
and it's difficult to just cross again, so better use a fresh wire.
ميتين وستين.
Just a minute.
ممكن ناخد ACT.
Once you have that sort of a kink under, I always worry that
Can we take an
it
ACT?
was from the circuit
No.
and might break, so it's worth getting a new wire.
We are getting it
No.
now.
Okay.
No problem.
بيتقفل من أقصى.
Okay, it's better to having the wire sometimes in the
حاجات
SVC.
This is a new wire. Do you want a new
Oh
wire?
yes, where it goes.
عايزين ACT.
Okay.
ACT. أنبوب.
Okay.
Or
Right.
even IVC, even better.
What do you
مش
want?
الأنابيب
to
عندك؟
use?
أنابيب عندك.
You need the multi-purpose?
Huh?
You will
Can we
need the
change?
multi-purpose
Can we
inside the
change?
sheath?
Can we change the sheet?
عايزين ACT.
Where I need to
Oh,
eat.
6 French.
So at the moment, does the TOE help you about where you've crossed or how things look?
Can you show us the TOE where we crossed?
عايزين
She's
ACT.
Just a
she's sit down, sorry.
Can we see the TOE?
Can we see
TOE
TOE?
من
Is the
زارع.
shift ready? Shift ready? Shift ready?
She's القصير. She's
I
القصير.
think 4 chambers first, and then we have a look at the tricuspid
Okay.
valve.
امسك يا مدام لان هياخدوا منك عين.
الناس بتتفرج علينا هناك على فكرة.
Can you hold this one?
Can we see the 4-chamber view?
4 chamber view أميرة.
Okay, and then have a look at the wire and catheter and the tricuspid valve.
قولي ده أمين يعني نظبطيه عشان لسه حاجة هندخله.
No.
فلاشات. Alright.
There.
But is it
And-
a bigger hole?
In the catheter.
والمالتي بيربس.
In the multipurpose. We need it.
And quick look at the color, and then if we go back to fluoro.
ممكن color
ممكن واحد color. مش هي color بعيد الماشين بعيد.
Where is the wire? Still there.
Okay. Okay. Let's go back to fluoro then, if we could, just to see what they're doing.
Can you move to fluoro? Fluoro, please.
Can you hold this one, please? Hold the
Let's flush the seats.
We're gonna make the loop again
Okay.
from the HVC.
مالتي بيربس.
بس
جهزي الاثنين على التاير بتاعنا.
Okay, meet unit happening. Meet unit.
So Mario, just whilst they're doing this, in this sort of
At that
position
moment,
now,
actually, if you want, sorry.
yeah, in this sort of position, they've got the catheter across a wire in the SVC. Do you still, if you're going for retrograde right now, would you do a circuit
Yeah.
or would you try? I'm just checking what Mario thinks.
By using retrograde approach.
Yeah.
Well, I just advance the stiff wire in the right ventricle and advance the sheath
yeah.
right across. There.
Yeah. So there's no need to do a circuit
Hold the wire.
for a retrograde approach.
Okay.
But for retrograde, I would like to have the catheter higher up, so when I advance, I don't lose everything first.
Yeah.
Agree?
Yep. Agree.
And if I make a comment when using antegrade or venous approach, well, it's easy to deploy the device starting in the aorta, but the risk is sometimes to pull everything out. Just to avoid that, I used to use a coronary body wire, just to not to break the circuit. If you get everything through, you still have a wire and you can re-establish the circuit without starting all over again.
Yeah, he's still.
No, it's the same. No, it's the same. No, no.
Yeah, it's still not smooth curve, is it?
So why
Yes,
don't you
it's
try integrate
not-
it? I mean, from the aorta.
Yes, I will do it right now. Pull, 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 pull. Push, 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 push.
Yeah.
Push, 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 push.
Yeah.
Push, 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 push. Push, 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 push.
So just for the audience, I think the problem is one of the morphology, isn't it? There are multiple holes,
Yeah.
and you can't
Yeah.
guarantee which hole you're going to go through when you cross. However, oh, microphone.
Okay. Can I take the sheath again? I will go for the
So
retrograde.
the loop that
Retrograde.
that you
Retrograde.
see suggests that the tricuspid valve is caught.
And the dry,
and so
dry gas.
I don't know if it's better if the wire goes up to the SVC or if you use a wedge catheter to go through the middle of the tricuspid valve
need to build this
and then out to the
other way around,
P8s. But whenever you see that loop, I think it means your tricuspid valve is caught, and the chances are that
I'm holding.
you're not going to be able to cross.
So the problem with, you can use a balloon catheter, that will get you into the pulmonary artery for the circuit, but it's still when you cross the retrograde approach, you don't know whether you, the wire is going around the chordae at that point or not.
Yes, sir.
But again, that's an important technical point as well.
Okay, 6 French.
So, Enda, just to double check, you've got a guide wire circuit, yes?
Yes, we did the guide wire circuit again, but actually we crossed the same point.
Yeah.
I don't know because we are safe from the tricuspid, but because of the morphology or the toughness of the ventricular septal aneurysm, it won't be possible to cross from the venous side again, and I will try from the retrogradely.
Okay. But you maintain the guide wire circuit now?
Yes, yeah, sure.
Okay.
To support. Okay.
Try and cross the little hole.
Okay.
Yeah, so, and one question is, you've now still got the Terumo wire circuit, whether you, if you put a stiff wire across now, whether that helps in the sheath crossing the defect or not.
Well, actually, Shaq, you know, if you push something enough, you can always cross somewhere.
Yep.
But it's important to not harm. So I believe that the stiffer wires may harm the tissues. So the making a circuit with the softer wire, like the Terumo wire, enough to support the system.
Okay.
If it goes, it goes. If it doesn't go,
then you have to think.
Doesn't go.
Yeah.
Okay.
That's fair enough.
Now I'm coming from the retrogradely with 6 French life tech.
And you will keep the loop in place, yes?
Yeah. And again, for my clarification, you've got a bare wire on the venous side now. Would you put a catheter across from the venous side for protection or not?
We could have done it. We could have done it, but not necessary, I guess.
Yeah, just try as it is. Yep.
We have to check with echo. If we crossed or not.
Well, apparently the sheath went across easily, right?
The dilator did. The sheath hasn't gone yet.
Dilator crossed, but not sheath right now. I'm still trying to cross with the sheath.
Sure.
And not crossed, I guess. Not crossed.
Why don't you show us simultaneous TOE and fluoro?
Yeah.
Is that possible, please?
Yeah. TOE is giving information me. We don't cross right now. We still not cross.
Can I suggest that you go from the venous side with a catheter, like make the reverse loop? I think it's easier having the catheter on the venous side to help to cross. And then pull.
Okay. No, I don't think so.
I think Shaq also suggested that before.
Not to keep the wire bare.
Because the wire is not flimsy, but it's soft.
So on the TOE, at the moment, I'm still not clear whether the sheath is across or not. I don't think it is.
No, the sheath is not across. I don't think even that the dilator is crossed already.
No,
because every time it bends when he
dilator
pushes.
Crossed, I guess.
I think the dilator is somewhere around the tricuspid valve.
In the left?
No, I challenge this. just to annoy you.
Okay.
Yeah.
Well, the question is that,
We have to cut.
well, the hole, as far as I
Catheter is very long.
understood the pictures, the floor pictures, the hole or the holes are very, very small. I mean, the aneurysm
okay.
is large,
Yes.
but one or two holes are pretty small. So you can push the redundant tissue, but without crossing the hole, in
I
fact.
think that's better to have them all touching there. Can we see the color, please? The audience wants to see the color. But put the color gain down a bit, please, Dr. Amir.
Reduce the gain, color gain.
Tricuspid valve flow, please.
No, it's
There is interference with the camera or something. It's not the color gain.
So comment from the TOE, ma'am, please.
Could we cross or not?
Did we cross by T?
No.
No, we are still inside the aneurysm.
Yeah.
Okay. We are still in the aneurysm.
We either inside the aneurysm or entangled the
Still?
papillary
No, we
muscle of
crossed, we
tricuspid
must
valve,
cross.
maybe.
No, I think they're inside the aneurysm
No, we did not
because
reach the papillary
tricuspid
muscle.
valve is free
Huh?
there.
We
to-
crossed? Really?
Try the long axis.
Microphone for Huwaida, please.
We must cross. No, cross?
Hold on, Huwaida. Yeah.
Double check.
Did we
Amina.
cross?
I'm not
Yeah, we
sure
should
that
have-
he's not
This
across
is the wire.
because I think that the kink in the bottom is in the tricuspid valve area, but the
Yeah.
sheath might be already across because it's pretty far down. So if you take out
No,
the
cross.
dilator and do an angiogram through the
Angiogram, yeah.
sheath, you might find that you actually crossed.
Yeah.
Stop, huh?
I think this looks like
Sub-
they're crossed, yeah. To the right ventricle.
We crossed or not?
They are suggesting an angiogram from the
you might
sheath.
have seen something in the RV.
It's a lot of air.
On
Just
most
a minute. Let it come. Why? Because of the wire. Because of the wire, it's not possible. We can give air. We didn't cross. Yes. Actually, we didn't cross.
You get the impression from the TOE that the sheath might just literally be either in the RV or near that aneurysm, so an angiogram will help.
No, where will we record? Which one? Record?
The cine is in the middle.
This?
Yeah.
You see, it's at the mouth
It's
of the
across, yeah.
aneurysm, isn't it? But
No, at the mouth. Exactly.
mouth.
yeah,
Not
it's
cross.
not quite across.
Not quite cross. Yeah.
So it needs a bit of a tug or
Yeah.
maybe a stiff
Okay.
wire. And get through. And maybe do a body wire like Dr. Mario suggested. Just
I
not so
think
looped
body
in.
will might make it more complex. Yeah.
That's the problem.
Yeah.
Always
It just needs a little bit of a pull, doesn't it, with the dilator across now?
With the dilator.
You don't have enough lens. Yeah.
Mhm.
Still it's out. It's not. Yeah.
Okay.
dilator seems
Could
to
you do a
cross.
tug now? Maybe a pull and tension on both ends of the wire. Maybe it's going to go.
Yeah. The dilator for sure is across it.
Yeah.
So you just pull and advance the sheath.
لا لا لا، رجع تاني رجع تاني. لا لسه موجود.
It was suggested here that
Yeah,
you should have
we
attention
must cross.
on
Yeah,
both
yeah.
sides
We must have crossed.
of
Okay.
the wire.
Yeah, that
Okay, we
looks,
crossed, huh?
that
now.
looks better, yeah.
That's
Okay, we crossed right now.
لا 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 خليك.
The dilator now.
ده دي كنا شايفينها اسهل حاجه، ما هي دي المفروض اسهل حاجه، هو ده اللي هو عايزه. والله بس هي طلعت اصغر من المفروض عشان صغيره. وصغير.
Yeah, we crossed.
عدى خش له خش له
Okay.
خش له.
Both of them?
Yeah. Okay.
Yes, that looks better. Yeah.
And just for reassurance, you could
Okay.
do an angiogram again. Before we break the circuit and device is delivered.
Because we can measure the pressure. We can see the tip of the sheath into the
Yeah.
RV. We cannot do an angio because of the wire inside. Make air
Oh, I see.
embolization.
Okay, well, measure the
So-
pressures then.
We have to go for TOE. Can you show us the TOE? Are we at the RV? Yes. Okay.
And also, you can measure
Okay,
the
then we
pressure
can
from
go.
the sidearm.
Yeah.
Flush pressure,
Anyway,
flush.
just a minute. I will make an angio right now.
You will.
Yeah, I will do an angio here.
Remove the wire.
Yeah. Just make angio.
بجد؟ وبعدين؟
No, not possible to make an angio. Okay.
عندنا بس الدنيا، وانا جاي هنا من الساعة 7:30. وبعدين الحالة مش ماشية كويس، انا بس قلت اكلمك عشان
Okay.
حاجة بايخة.
We are ready.
ما احنا كلنا بقى تيم. ما انا اللي لابس المايك.
Okay, that looks better, doesn't it?
Okay.
So you're way across.
So now can we see the device
Yes.
and the loading? Maybe you can explain
Okay.
a bit about the MFO device.
Six.
Doesn't it?
Yeah. 8. What's the measurement?
ما انا سكت خالص.
8 by 6 or 9 by 7.
هما بيتكلموا بقى اللي شغالين. انا قدمت في الاول.
9 by 7.
لا عشان واقف.
Yeah. We're going to use 9 by 7 device. It has 14 millimeter skirts, a little bit oversized because we have good aneurysm and also.
And
Yep.
firstly, how do you select, based on some of those measurements, how did you select the size of the device?
Okay, we have measured the base of the defect with angio 8 millimeters, with echo around 10 millimeters. The color Doppler of the VSD is 5 to 6 millimeters with color Doppler.
Okay.
So we have two choices in that situation, I guess. The first one is using the 8 by 6 and the other one is the 9 by 7. Because the fabric material, the patch inside of the device starts from the 9 by 7, the capability of the closure of the defect is the device increases after 9 by 7 size.
Okay. And
It's
the
a little
9
bit
by 7.
oversized, I know,
9 by 7, that's the one you're going to use, yes?
Yes,
And the discs on that are what?
14.
So RV and LV both 14, so they go up by,
Yes.
right, okay.
Okay.
So
Can you see the device?
because the 7 is inside between the two discs.
Yes, now we can see the device. Can
Okay.
you just explain the components of
Is
the
this
device?
9 by 7?
Without dropping it.
Okay. Can you see the device?
Just focus
No.
on
Not
Professor
yet.
in the
No.
hand, please.
No, dear.
He is zooming on your hand.
Can we see it right now?
No,
Can
we
we
see
see it
your
now?
hand. I think
Uh-huh.
the camera is
Which
coming
hand?
at the other angle. Can you put
We
it in
need
your...
to look
Yeah,
at this.
Hold on, the camera needs to zoom in more. That's it, keep going.
Yes.
Okay, using
Can
an
you
RT
see right now?
forceps, Ender, if you could tell us where the 9 is and where the 7 is.
Okay, if you can see the
Yeah.
device, I
Yeah?
try to explain. Can you see it?
Yes?
Okay. Okay, this part, the screw part, there are two screws actually, and the different shapes at the both sides. The first side should can be similar, resemble to the ADO2. The other one looks like the ADO1.
Yeah.
I will try to leave the ADO1 looking side to the LV because of the aneurysm.
Yeah.
And the LV side of the device is 9, and it's narrowing towards to the septum like that, and it reaches 7.
Yeah.
9 by 7 is that. And with the skirts, it reaches up to 14 millimeter.
Yeah. Okay.
Okay.
Good.
Then you can screw the device both sides according to shape of the defect. Because we are coming from the retrograde side and we want to leave the ADO1 similar side to the LV, we will screw from this side.
From
So the other side.
from the RV side or LV side? LV side, aren't you?
LV side.
Yeah.
Yeah. So the bit that looks like an ADO2 will go in the RV and the other bit will go in the LV.
Yes.
Correct? Yes.
Yeah. This is my intention. Flush. It's very soft and tiny device. Okay.
So the important difference, just to emphasize for the audience, is that the 9 by 7 has a patch material, yes?
Yeah.
And the 8 by 6 and smaller do not.
Can you flash again? Okay. I'm loading the device now. Pulling back.
Okay, if we can see the fluoro as well now.
Fluoro, Mustafa.
You keep your wire in.
You still have the wire inside the sheet, right?
Yeah, I will pull
It's
back.
being pulled slowly.
I will pull back it.
No, I mean, if it's possible to advance the device, leaving the wire in place, why not to keep it there? So that's an extra safety measure. I mean,
Actually, I take it always cause the possibility of the stacking of the device inside.
wow.
Yeah.
That's
Not
why
to
I'm
put any
pulling
pressure
back.
on you or anything,
Pull
but
back,
we have
pull back,
9
pull
minutes on satellite time left.
Pull back. Smoothly, not too. Smoothly.
Now it's important to have a fluoro and the echo simultaneous,
Pull, pull,
because
pull.
you don't have an
Fluoro and
additional
echo together, please.
catheter to do
On
angiogram.
screen.
We'd like to see your hand,
Are
echo
we
and
in
fluoro.
RV right now? Still RV?
Yes, that's it.
Okay.
Can we have echo big, please?
No, no.
Pull back, pull back.
This is important.
Pull back the shift. Pull back the wire.
Echo.
Oh.
Okay. Where are we right now? We have to check
Echo?
with echo. Still in the RV?
Yes, the device looks in the this looks.
Yeah. Based on the aneurysm? And
The
the
right
LV?
side or the left side?
RV side. Yeah, okay. So we need to make an angio here. Give me the saline. Dye, please.
I think, can the echo person show us a short axis view? Sometimes also it helps to see where we
Short
are.
axis view.
Where are we actually? I don't understand.
Well, I think the
Can you show
device
us
is
the
deep in the
device?
right ventricle now. You have to
Yeah, yeah, I will pull back more.
consistently.
Pull back more.
Short axis, I mean.
Well, now probably it's too late, but it
Yes.
would have been useful to have an additional arterial
Where are
catheter
we?
Yes.
to do the angiogram in the aorta or
That's more
LV.
free
huh?
now in the RV, I think.
Are we away from aorta? The VSD?
Yes, we are away.
We
Here,
are
here it
inside
is,
the
yeah.
RV here.
It's
Yeah.
still
Yeah,
mid
that's-
RV.
We
That's
can see
better.
it
See
here
the
in
device?
the RV, yes.
And
It's clear in the
focus
RV.
on the VSD, please.
Okay, and we won't interrupt you. If you've got about 7 minutes, you carry on, take your time.
Okay.
It has to pull more back.
Are we away?
شوف
Can you
ال- no,
show
no.
us the... Still? Can you show us the angio, the first angio? Where is it? Okay, it would be somewhere here.
I
Can you
think
show
it's at the mouth of the
Yeah.
aneurysm
Let's
now.
rotate, search for the device.
Yeah,
The angelic route.
yeah.
Oh, sorry.
Long axis. Where are we? Where are we? Still away?
We have 3 minutes left, so I'm not putting pressure on you or anything. Can we open the device?
Yeah, but
We have opened already the device.
Are we still away?
We are still away. Yeah.
But consider the aneurysm as well.
This is the right. This. Just have a look on the.
think
And
it's
at the
all
right?
in-
No,
looks
where is
like
it?
all in the
Full,
LV.
at the right.
At the right
Okay.
side, yeah.
Okay.
It's all in the right, yes.
I think there's a little bit of
No.
uncertainty, so I would do an
No.
angiogram there if you could,
No.
with a sheath
Still.
close to the screw.
But I think, well, before recapturing the device,
Now it's okay.
yeah, but there is no...
No, we are okay right now.
Yeah, now it's
Yeah,
okay. Now
okay.
it's
COE.
Right.
Now we see both discs. One
Yeah,
of the RV.
however, you have a lot of space in the aneurysm. Even if you put all the device in the aneurysm, it will not go anywhere because the holes
Okay.
are too small.
So that looks good position on the angiogram.
Yeah.
You're
Yes.
below the aortic valve.
Yeah.
On
I
TOE.
guess after we release, the position will change, then the orientation will be better.
Yes,
Okay.
can we,
Yeah.
we have 3 minutes
Yeah,
left. Can we
yeah.
advance the sheath a bit
What?
to the
What do you
screw
think?
and do an angiogram?
Seems?
Well,
So
I
you're
think
going to unscrew now? Yes.
Okay, it will change, but it will change. It will change. The most important thing is we have to have one disc at the right and one disc at the left, or aneurysm, right? So we are safe. So we can release it.
Yeah.
Okay. Bismillah.
You want to release it under Cine?
Yeah. Yeah, I
They
release it
just
right now.
released it.
Very good.
That's much better, for sure.
Okay.
So, Ender,
The fake completely closed. Yeah.
yeah, Ender, that looks
TOE.
good. If we could just do a final
completely
TOE color evaluation.
Yeah. Please show us the TOE.
We've got 1
On
minute
TOE,
before the
the fake
satellite cuts
completely
out.
closed.
Show
No
us the
AR.
TOE on screen, please.
And TR, please. For TR.
TR, come on, not TR. Perfect.
No TR, yes.
No TR, no AR, no residual shunt.
Okay,
looks
brilliant.
really good.
Well done. That's an excellent result with the retrograde approach of the
Thank
MFO.
you.
Thank you. Congratulations to the whole team.
Thank you so much. Bye.
Thank you.
Thank you very much to the audience. I think they're running out of satellite time, and the next session is due
Would
to
you like
start.
to do an
Yeah, thank you.
angio
Thank you.
for showing it? Okay. What's that? This one is
This
pigtail.
is the venous side.
Okay, pigtail. Can I take a pigtail?
خلاص لايف ترانسميشن
Pigtail.
اوكي خلاص we're done
Can I take a pigtail, please?
Pigtail. لا pigtail هيحن بيها.
Pigtail, yeah. لازم أنا.
The regular pigtail.
No,
خلاص
لازم أنا.
اقطع عنه من
It's good, it's good, it's good.
Then back to this one.
Yeah, yeah.
So wire.
Terumo, please.
Wire.
اوتكم بيرفكت ما شاء الله حلو قوي الحلقه
Well done. Excellent.
Thank you.
It was a little bit tough to cross at first. The
Yeah,
aneurysm did not look friendly actually.
Yeah. It's
ممكن
not surprised to me. Because
هو
as
اللي
I said,
حصل انه طلع اصغر
you cannot
من
cross from the venous side.
Test. 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 Professor Gali? Do you hear us?
Hello?
Do you hear us, Professor?
I don't see you.
Uh, you will not see us at the meeting room, but we will see you and we will see your presentation to be presented to the audience.
Yeah. I'm connected, but I see only myself.
Okay, can you share your desktop to see your presentation?
Okay?
Okay, we now see your presentation and your photo also.
Yeah. You see the arrow?
Yes.
Okay.
Yes. Let's try the speed of the presentation and the videos.
Okay. You see?
Yes. All videos are excellent. Do you hear us well?
Yeah.